Well, intensifying surveillance across the country, as well as reporting cases of rashes for risk profiling to curtail the spread of MPOX in the country have been re-echoed on Good Morning Nigeria. The guests are emphatic that though the strain in Nigeria at the moment is less virulent, health workers must be on high alert given the unpredictable nature of these viruses and their potential to mutate. Lydia Sampson reports.
Though MPOX is highly transmitted through sexual contact, medical experts are urging Nigerians to be cautious, prepared and continuously wash their hands and use sanitizers to contain the spread of the disease in Nigeria. They are optimistic that if lessons learned in curtailing Ebola and COVID-19 are deployed, Nigeria can contain the disease.
MPOX is not like COVID that is spread through, by aerosol and others, but this one is contact. You have to come into contact, either skin to skin contact or sexual contact and all this. So it makes it much easier, to really, protect yourself from MPOX. But unfortunately, and that is the most important aspect there, almost 80% of the cases are mild.
We have that collaborations and we have the exchange program whereby we can support the other countries, and that we have, and that is why we have the system in place whereby each member country have what we call the search staff. We call it rapid response register for each countries. Then the African country have the central one whereby they look at what individual country have in terms of capacity to be able to support other countries.
The guest reiterates continuous health education to equipping the people with knowledge is critical.
We need to be able to produce our vaccines. There may be a time when we would need to vaccinate people against MPOX because there's a vaccine for it.
Okay.
But again, the most important vaccine is our attitude. Hygiene conscious, wash your hands as frequently as possible, be clean, personal hygiene, environmental sanitation, keep your ears open so that if you hear of something that could affect you, you respond appropriately.
Tracking coordinated response amongst countries, the health experts acknowledge must be expanded. They also emphasize the need for more funding and equipping of primary healthcare centers for proactive interventions. In Abuja, Lydia Sampson, NTA News.